Hello. So I figured I would do a update on my health. So as I've talked about before, I had a TEE where they found out the masses in my tricuspid valve are bigger than they thought, and the regurgitation is worse. I talked to my cardiologist about possibly having surgery, and then I met with a cardiac surgeon yesterday, which, as of today, is May 12th. And we figured we'd scheduled me for having them repaired, hopefully repaired. But because of the location, they have to do the scar here and go in and repair it. And if that doesn't work, use animal tissue to repair the valve. Now this scares me. It is open heart surgery. I also found out that I had an appointment with medical weight management program on the 30th. So that was exciting to hear that had gone the way it did. For my vital signs, my blood pressure was 104/64. Height, I've weighed the same, I've been the same 166 centimeters since I was 14. So what it really is it's for tricuspid valve regurgitation and something called papillary fibroelastoma of the heart. They don't really know for sure if that's what it is, but that's what they have for a diagnosis for me. I'm currently still on my blood thinners and stuff, but they showed, they have here some education materials. So they have the heart valve surgery. Once a valve problem has been diagnosed and surgery scheduled, you'll have to do some things. Some preparations will help make your surgery go smoothly. Some will help you set up for your return home from the hospital, and others will help you feel more at ease. Your doctor will talk to you about the risk. Write down all your questions in advance so you don't forget to ask them. So, the week before surgery, I need to ask my doctor about scheduling any dental work that I may need done. They found that I don't need the dental work done, but dental work could let bacteria in your bloodstream. This can cause infection in the new valve. So, they found I don't need to do that, the dental work, but I do need to brush my teeth 3 to 4 times a day the week before with mouthwash to kill any bacteria that can get into my mouth. Also, the week before surgery, give your doctor a list of every medicine you take. This includes supplements and over-the-counter medicines. Your doctor may have you stop taking some of them, so I know for a fact I'm going to have to stop taking my blood thinner. If you smoke, quit right away. You will do better during and after surgery. Arrange for an adult family member or friend to drive you home from the hospital. Have a helper available for your first week or 2 home. I got my boyfriend to help me, so I'm not too worried about that. Prepare and freeze food or arrange to have food brought in while you recover. There's going to be plenty of food here if I need anything. I know Shane will help me with that. Make changes around your home to make it easier to get around. One example is to reduce the need to climb stairs, but I'm going to have to climb stairs in order to go to the bathroom. The day before surgery, you may be asked to wash with special soap the night before surgery. The morning of surgery, don't use deodorant, lotion, or perfume. Follow any directions you were given for not eating or drinking before surgery. Excuse me. And then during your surgery, your surgeon will first gain access to your heart. To get to the heart, the surgeon usually makes a cut or incision down the center of the chest. The breastbone is then separated. So the center of the chest here where I talked about. If your surgeon plans to reach your heart by different means, they will discuss it with me. So he's going to go right for the sternum. For certain types of valve repair replacement, cardiac catheterization or balloon may be recommended. A heart-lung machine will put oxygen in your blood so your heart and lungs can be still during the surgery. The surgeon will either fix or replace the problem valve. If you have another heart problem, the surgeon may do a second procedure at the same time to take care of it. So I have the regurgitation, and the masses, but they're both in the same valve. So, after surgery is done, the surgeon rejoins the breastbone with wires. The incision is then closed. In many cases, the breastbone heals in 6 to 8 weeks. So, there are 3 ways to treat problem valves. Different problems call for different treatments. Your doctor will talk with you in advance about the treatment that is best for you. In some cases, though, the pain may need to change once surgery has begun. So the 3 basic ways to treat valve problems is repair the valve, which is the one he's going to try for first in my case. Wherever they can, surgeons prefer to fix a valve rather than replace it. The most common kind of valve repair involves sewing a ring around the entrance to a valve to improve its size or shape. Another involves cutting tissue to let leaflets open or close better. When repair isn't possible, the valve may need to be replaced. So the other option is the replacement with a mechanical valve. Because mine is in the tricuspid valve, they said this one's not really an option for me. And then the other option is replacement with the tissue valve. A tissue valve usually comes from a pig or a cow, but they also come from human tissue. Blood doesn't clot as easily on tissue valves. So people getting tissue valves may need warfarin for only a short time. Aspirin is sometimes used instead. Warfarin is Coumadin. This is the most common one. Xarelto is what I take, and it's a newer blood thinner comparatively. Tissue valves may wear out faster than mechanical valves, so they may have to be replaced sooner. That's the downside with a tissue valve. Whereas with a mechanical valve, the bad part is that blood tends to stick to them, forming clots. So you get a mechanical valve, you have to take a blood thinner for life, which I have to anyway. So then we have some more paperwork. So that was just it on that. I just wanted to talk a little bit about what needs to be done, my surgery. I'm going to probably record some more stuff of me going through stuff because I'm hoping they have an extensive pre-op book and eating for a healthy heart. And I have to say that at Northern Light, they have been amazing with giving me the information I need. So, thanks for watching.